I recently injured my little finger. Originally, I called the 111 service to find out what their advice was, and after giving them a detailed description of the symptoms, they advised that I went to the local walk-in centre in Colchester. I went down and sort of checked myself in at the reception desk, and the lady on reception said that I would be seen by a nurse. They had the radiography equipment for me to have an x-ray at the walk-in centre, and then following that I'd be referred back to the nurse and I should be dealt with within the walk-in centre. So it was probably about just over an hour and a half before I actually got seen by the nurse, and she said yes, she thought I needed to have an x-ray. So I waited for about another 30-ish minutes, saw the radiographer. Because of the way that the bone had fractured, she wasn't happy sending me away with just the splint that they can put on in the walk-in centre. So she then phoned across to the accident and emergency department and spoke to one of the SHOs. And then the feedback that she got on the phone was that I would have to then go over to A&E, but because the systems don't talk to each other, I'd have to start all over again. So I did that, went over to A&E, booked in, advised them that I'd been sent over from the walk-in centre and that the phone call to the SHO had just happened, but she was adamant that I had to start that whole process again and that the notes weren't transferable. So I had to sit for another hour in the A&E department. By that stage, I'd been there coming up for 3.5, nearly 4 hours. So I went through to another person who looked at my x-rays within the A&E department and then basically sent me away with the same finger splint that I was put on in the walk-in centre.
So one of the things that we know about the current A&E department here at Colchester is that it's not designed in a way that we can accommodate all the patients who are currently coming through at the moment, both in terms of the staffing that we have and in terms of the physical environment. So giving the public the opportunity to be treated at another service away from the acute hospital would allow us to provide quicker, better care to those patients who have to come to A&E.
The current pathway that we follow at the moment is where we obviously dial 999 if we feel we need assistance, and then the resident will go with the ambulance crew all the way to Colchester, which is quite a long way from Walton-on-the-Naze or Clacton, and it really does upset them. It really upsets them. They feel frightened. They don't know the people when they get to the other end, and it's often too far for the staff to go, not knowing when they will be able to return back to the home.
What we're looking to do is alleviate, firstly, the pressure on our urgent care services. So that would mean less people having to go to A&E for minor injuries. What we're hoping is that through a minor injury service, these people who have ailments that can be seen within that service can be seen more locally, closer to home and away from the hospital.
So the improvements that Approach 3 would bring for us would be that patients will be able to seek care closer to the home, which normally would bring better outcomes. It's better for the patient, usually better for their loved ones and also their families as well.
It's much easier if something is on our doorstep. It's not so far for the residents to travel, and I think therefore we've got better chance of our own staff escorting them to the hospital, and hopefully their families as well are more likely to pop along if it's just along the road.
Also, what we would see with that is ambulance times reduced in the sense of that we haven't had to take them to possibly an already busy ED department. There's been seen closer to home, therefore the turnaround time is less, and the ambulances are freer to be made available for patients with emergency life-threatening conditions.
The added benefit of doing something like that would mean they'd get the right care in the right place, and also it would have the increased benefit that we're not handing off to other services, so it reduces the number of people in the system that they have to communicate with, so it makes it clearer for the patient and clearer for the system to understand what's happening.
People are very worried about their health. People get very scared if they've got a condition or they've got a pain or an ailment or they don't feel well, particularly if they haven't felt it before. So I think that we need to be able to provide as much information as possible to patients through the internet, through various other media, so that they know if they've got a condition that they can treat it themselves.
It's important for us to have patients to have the ability to self-care because they might go see their pharmacist, they've taken responsibility for their own care at an earlier stage, so their outcomes could actually be improved. So it's important to us because that would reduce the calls that we receive to the 999 service because they've already taken advantage of their self-care and seeing a pharmacist, for instance. And also it's leaving the ambulances for those who have got real, genuine, life-threatening emergencies like your strokes and chest pains, to which we really do need to get to as quickly as possible.
We also know, and there's a lot of evidence to suggest this, that people with a long-term condition can be supported to manage their condition differently at home and by themselves. So, for example, patients with COPD, it can be really frightening when it gets particularly cold or particularly hot, or there's a condition that exacerbates their condition. They become breathless, they become frightened, and often there's a knee-jerk reaction to call 999 or call 111 or call the GP. Many patients have learned that with support from peers, particularly self-care in those situations for COPD, for some heart disease and everything else, is much better for them.
The best way for us to encourage it is through every time a healthcare practitioner has an engagement or an interaction with a patient to help them understand why this has happened and how they could manage it themselves better at home.
They do require the assurance. So, for example, just having a helpline that people can pick up the phone, talk about their symptoms, get support from other people with a condition, means that we can take the pressure off the NHS, which at the moment is facing unprecedented challenges and quite simply won't be able to withstand the pressure that we're going to see in a place like Colchester, where we've seen some of the largest growth of new people coming into this town in the country.
So the quality benefits of Approach 3 is through for the patient firstly, and that they'll get a better quality of service because they'll be able to get access and treatment in a centre that's dedicated towards that, so it's not, if you like, being distracted through major emergencies or through other services that they need to deliver. For the system as a whole, what it would mean is that the A&E department doesn't have to deal with minor injuries that actually could be dealt with in another setting, so the quality of care for major trauma or for people who are very sick also improves through doing this.
The quality difference that Approach 3 will make to the services means that our staff will be able to care for those patients who need their specialist care rather than patients that don't need the specialist care of a doctor or a nurse in the A&E department.